not just the medical system, but the school system, is like, we are not teaching our children valuable things in the school system about health and about stress reduction. And so when Dr. Stober would adjust the child's head and loosen the meninges, it would loosen their contractions.
The fluid.
When the sphenoid moves, it stimulates the meninges to start flexing.
Right.
So, like when a baby's born, they look really funky.
You're able to look at their face, the facial structure, and you can pretty much tell if they need a treatment of NCR or not. Is that right?
I think it's beneficial for everybody. I mean, we fight gravity is our biggest problem on this planet.
Welcome everybody to the program. This is Health in Focus. I really appreciate your tuning in today. My name is Jacobus Hollewijn. I'm more like a journalist. I'm not a doctor, but I like to interview doctors to get their perspective on certain aspects of health. And today I have Dr. Hilary Lampers with me, who is a naturopathic physician. She was born and raised in Bozeman, Montana, moved temporarily out of the area, but has moved back right here in Montana. And so we're going to talk with her today about neurocranial restructuring, or NCR for short. Welcome to the program.
Hi, Jacobus. Thanks for having me.
Yeah. The reason why I wanted to talk about this is you and I actually, when I had my radio show, you have been a guest, and we talked about this topic, and I've had requests and comments from people afterwards. And I have sent people to you because I noticed I learned so much from you about this and how important it is that people know about it. A lot of people have issues with their head and they don't even know about it. So I thought maybe you can tell us a little bit about your history, what happened with you, and how did you get into this field? Number one, you're a naturopath, so I want to talk about naturopathy.
Yeah.
But I would like to understand more about NCR.
Yeah, so, boy, where do I start? I was a child who grew up with headaches, basically, and that was something that I had for most of my young life and really just thought it was normal. And as I got older, they got worse. I had some other structural issues, like I was born with an extra bone in my right foot and things they didn't even find it till I was in my early 20s. And I think that probably played into it some too, because as we're going to talk today, the structure is, your feet and your head, like everything is connected. And especially with our stability patterns and our balance organs and the structural skeletal system and muscles, really everything is talking to each other. And
by the way, I want to say that to have headaches every day, I cannot imagine what that would be, but in your case, you didn't know any better. So you never communicated with your mom or dad and say, I have headaches. Did they understand it? Did you understand the word headache in your case?
Yeah, I did communicate. I think I did. It was a long time ago, but I do remember my mother, I think when I was younger, took me to a doctor and they couldn't find anything wrong with me. And so it was just like, well, we don't know what it is.
So they give you pain pills?
You'll grow out of it. They didn't really give me any pain pills, I think, because I was young. And back in the 80s, 70s and 80s, I don't think they were handing out pain pills the same way they are now. So I think there was a lot of like, this is just kind of how it is and we don't know what's wrong. Everything seems fine.
Yeah.
But as I got into my early 20s, it was really starting to affect my life. And in my late teens, if I kind of back up a little bit, I had been diagnosed with candida. So when I was a teenager, I got a bladder infection or something, and I had to take 2 really strong rounds of antibiotics. And after I was also a child, and probably again it was part of the headaches and whatnot.
Yeah, yeah.
I had tubes in my ears as a baby. I didn't drain my ears. I had lots of ear infections. So
Oh, wow.
I was on antibiotics, I think, quite a bit. They did hand out plenty of antibiotics in the 70s, obviously.
Yeah.
I had my tonsils out when I was 5, which was very common as well back then. They
Yeah.
just kind of took
I
everybody's
had mine
tonsils
taken
and
out,
adenoids
I think,
out.
when I was 4 or 5.
Yeah, it was very common. And so I think that I just had some of that compromise when I was young. And so I was on lots of antibiotics. And as I got into my teenage years and I had to take these strong antibiotics, it set me into tons of like being chronically ill, fatigue, racing heart, GI complaints,
Huh.
Headaches, of course, but headaches kind of always been there for me. So that was part of the picture. And so when I was 17, here in Bozeman, actually, there was one naturopath. I mean, I knew of one naturopath. There might have been a couple more, but there really wasn't any.
Yeah.
And somebody said you should go see this lady because she might help you. And I had been to a bunch of conventional doctors, and they just kept giving me medication. It wasn't working. I was feeling worse. And so I went and saw Dr. Moore was her name, Willow Moore.
Willow Moore, yeah.
Willow Moore. And she did blood microscopy at the time, which was very out of the box then.
Right.
In the late 80s. And she...
Was that the live blood analysis, the blood microscopy?
Dark microscopy.
Dark field.
Dark field. And so she said, oh, look at all this stuff in your blood. It's not supposed to be there. Of course, I wish I would have listened to the interpretation more, but I was 17, so I really was kind of like, what? I wasn't paying attention much. But basically the story was you're pretty sick. Your blood is not looking well. You've got lots of yeast in your blood. And you need to radically change your diet. You need to radically change your lifestyle. You need to start taking all these herbs and nutrients. And because I was so ill, I was really motivated to do that. And so I did it.
Yeah.
And miraculously, in a couple months, I started feeling better and better. My symptoms got better, and probably my headaches got better, even if I think about it, right? Because again, it's all connected.
Yeah, it is. Still impressive at that age that you understood enough that you said, I got to make a change.
Well,
that you had that discipline.
Chronic illness is interesting because in a lot of ways, it takes away your motivation. It takes away your energy. You'll see this in a lot of patients who are chronically ill. It's just exhausting, right? Like just getting out of bed is exhausting. But there's also a motivation to figure out what it is, and you're more willing to step outside of the box and to do the things that maybe the average person who doesn't understand that, they may not understand the correlation of their lifestyle and their diet and everything to what they feel, because they don't really ever get that sick. They don't feel bad all the time.
Right.
But when you feel bad all the time, you have sort of a motivation, and I realized at the time that like the conventional medical model was really doing nothing for me except making me worse, really.
Right.
And so I was
very And I wonder why that is, because there are quite a few, obviously, neurologists and people who work with bones in general, but it seems like what your field is, one of the things in your field is it's so-called invasive. Let's say it is invasive, but at the same time, it's so gentle and so effective that you wonder why not more medical doctors are doing what you're doing right now. But we'll get to that in a moment. It was interesting.
I think that, now that I'm a physician and I went through the training, is that the way in which we're trained, and this is even true for naturopathic schools. So naturopaths had to do a lot to get recognition. They still do. We don't have licensing in every state.
Correct.
We don't have national prescribing. Every state is different based on what you can do, what you can prescribe, how you can treat. So it's still, there's still a lot to be done there. But our forefathers, our mentors, the people that really stood up against the system at the time and said, no, this is foundational health care. this is something we've been using for hundreds of years. You know, the typical naturopaths
Yeah.
and even chiropractors, you know, they came from Europe, and they had been practicing this type of medicine for a long time.
Uh-huh.
And this was pre having access to antibiotics and all the modern medicines that we have now that do save lives for sure.
Mm-hmm.
But we also know that this medicine is very grounded in teaching the patient how to take care of themselves.
Mm-hmm.
So I think that's where conventional medicine, as we call it, or allopathic medicine, has lost a lot of its credit. Because anybody who
Yeah.
takes the Hippocratic Oath,
Mm-hmm.
you know, the first thing in the Hippocratic Oath is do no harm.
Mm-hmm.
And when medical mistakes or drugs, medical prescribing and whatnot is the third leading cause of death in the United States,
Yeah.
there's really that do no harm
Mm-hmm.
is not being lived out. And what it's turned into is that doctors are just treating with either medications or surgeries, and they're not educating. Docere is doctor. Docere is Latin for doctor.
Okay.
And docere means teacher.
Teacher. Mm-hmm.
So you are really a teacher. And if you're not teaching your patients how to go out into their own life and to live a life where they don't need you,
Mm-hmm.
then there's something missing there, right?
I see.
And, you know, we could go down the rabbit hole of the industrial medical complex, the military complex, like the pharmaceutical companies, the food companies.
Yeah.
I mean, this is, now it's basic knowledge, you know, that the strongest lobbying organization in the world is for pharmaceutical companies. They
Right.
have the most money. Over almost 80% of the FDA's funding comes from pharmaceutical companies. It does not come from your tax dollars. It comes from pharmaceutical companies. We know that most of the media, they get their advertising and paid for by pharmaceutical
And
companies.
that used to be not the case. It used to be an unethical thing for doctors, for example,
Yes.
to advertise. And I want you to continue, but I want to jump back for a moment for those people who don't know about Western medicine being the third leading cause of death.
Yeah.
This was actually published in 2016 by Harvard University Medical School. That you can look it up. You can look up this study at, I even think, National Institute of Health Library, the PubMed website.
PubMed, yeah.
And there is then in 2018, Johns Hopkins University Medical School came out with a similar study in which they indicated that about 400,000 people die in this country every year, just this country, because of issues with Western medicine, either the wrong surgery, sepsis in the hospital, prescription drugs, the side effects have triggered that. So 400,000 people, that's a lot of people.
I mean,
and
to
that
put
made it
that
the
in
third leading.
perspective,
That's right.
I believe last year, over around 150,000 people died of fentanyl overdose.
Huh.
Okay, accidental fentanyl overdose, or, you know, not accidental. That's 150,000 people, which is huge. That's a crisis, right? Nobody's talking about that.
Not enough.
However, 400,000 people dying from prescription medication,
Correct.
from surgeries. Now, I've had surgeries. I had a surgery on my foot with this extra bone. Like, they were able to, somebody knew how to change my life for the better.
Yeah.
So I am not against allopathic medicine, but I think what I'm trying to say is that the medical system in general has gone farther and farther away from docere. It's going farther and farther away, obviously, based on the research, from do no harm. Okay? And patients are getting sicker and sicker. The United States is one of the sickest countries in the world, yet we spend a lot of our GDP on healthcare.
Correct.
And that's mainly in diagnosis
Uh-huh.
and treatment, quote unquote, surgery, whatever. But as far as prevention goes, as far as teaching, as far as education, it's a very small piece of the dollar. And that's because it's not profitable. So we all need to make a profit. You own a business.
You bet.
I own a business. We need to pay our bills.
Yep.
We need to make profits. And so the medical system has to make a profit, and you have to have deliverables. And so this is where, again, doctors are strapped by their where they work. Nowadays, it's very rare for a doctor to have their own private practice.
Yeah.
They work for polyclinics. They work in hospitals because they just can't afford. The cost of running a health clinic today is very expensive.
You bet.
And so we get further and further away from teaching our patients, educating our patients about what they can be doing in their life. And that means we also get further and further away from the core values and the basic core fundamentals of health. So if I were to think of, when I was 17, what were the core fundamentals in my life that were leading me maybe to be ill? One, I had been heavily treated by the medical industry with antibiotics.
At a very young age.
At a very young age.
So your body is still growing and developing, and those type of dosages can have a bigger effect on a young child than on an adult.
Right. I was also under a lot of stress. My parents got divorced when I was a teenager. My stepfather was living with us. Like, there was a lot of family dynamics. School is very stressful for kids. I have a teenage daughter now.
Yeah.
School is very stressful. I see her in the summer do well. Her acne gets better. She feels better. She goes back to school. She's stressed out. She starts, so you see it. It's a stressful time.
Yeah.
I'm also a woman, so my hormonal system at that time, very complicated. Girls are going through puberty. Their estrogen is going all over the place. And there's that change that's happening in the body. I wasn't eating well because I was in high school and I wasn't having anybody control my diet. And so, I was eating like cookies for lunch and Little Caesars pizza, whatever I could afford.
Yeah.
I wasn't, my diet was poor. I was a dancer, so I was in dance. I was being active. But if I were to look now and I were to have a patient to come into me with these symptoms, the first thing I wouldn't run to is the antibiotic. I would be like, unless she had like an obvious issue, she's very sick, she has a fever, she has a UTI. I mean, thankfully I could get that UTI fixed with an antibiotic because in the past that could have been deadly, right?
That's right.
But
there has to be a follow-up.
Side effects that happened with that, sometimes we don't realize, and everybody's microbiome and they're just made up differently, right? And so I think I had a lot of those co-founding factors that led me to just over time my immune system to become run down, not to feel well, and then I got that hit of antibiotics, and it could have just been the straw that broke the camel's back. It was already building up from my poor diet and my stress, and maybe I wasn't sleeping really great, whatever. And so these things lead up. So now that I can see that as a doctor, I look at like the system now allows 10 minutes with a patient. So no doctor except for Dr. Moore, that I ever went to, did they dive into my lifestyle factors? Did they dive into my stress? Did they dive into my diet? No, they just gave me the antibiotic. They gave me that. And so the nice thing about going to Dr. Moore was it was like, wow, she's teaching me these things that I really need to know that are like lifelong skills.
Yeah.
Learning to take care of yourself is like a skill. It's something that you either learn through programming, right? So if you grow up in a household that your parents are very dedicated to food, they're healthy themselves, they are demonstrating behavior that says like exercise is good for you and we don't drink alcohol very much and we're not smoking and we go to bed at a decent time and we value that.
Yeah, you bet.
It's really
it's easy
children
pick up on that.
Children get that program.
Yeah.
And I don't know if you've ever listened or followed any of Dr. Lipton's work, Bruce Lipton, but quantum physics and the whole idea of health and he's like, what he says about children is that before the age of 9, they're basically running the program. they don't make decisions for themselves. Their parents make decisions for them, or whoever their caretaker is, right?
You bet.
So they're making the decisions, and they just learn the program. So if the program that they're involved in and part of as a young child, whether it be from birth to 9 or whatever, they're not going to question it. They're just going to see that as normal. So if they live in that type of environment, then it's normal for them to see that healthy food is good for me and that I need this food. Now, are they going to be perfect all the time? Of course not.
No.
However, if you live in a program that tells you bad food is good, that tells you we go to the doctor and get a medication every time we're sick.
We don't feel good.
Which I see in a lot of parents. Their kid gets a fever and they just run right to the doctor.
That's
and the
right.
doctor half the time's like, well, he's got a fever. This is okay. Like, you need to go home, right? But they're just looking for that all the time because it's nerve-wracking to have young children and have them be sick. But, like, that's the program. If obesity is common in your family, if smoking is common in your family, if alcohol and addictions are normal in your family, this becomes your program.
Yeah.
So then you get out of, you get older than 9, you hit puberty, you get in this age, now you're in your inquisitive mind. Now you start questioning the world. And this happens to all of us. We start questioning the world, right?
That's right.
And we see our parents now as like humans.
Yeah.
That got problems.
Yeah.
That don't follow their own rules all the time.
That's right.
But if your program was set when you were young, it's very difficult. When you get into that age, you start questioning. The problem is that if you don't question and you don't get around, you don't get the information that's going to better you. And let's say you choose friends who have poor habits, and you don't get good grades at school, and you don't have teachers that motivate you, and you don't whatever. You're not in athletics. You're getting in trouble. You're reliving the program. You start gaining weight. You're eating bad food. You get obese. And I mean, with 30% of our children now obese and or having metabolic syndrome, that is a death sentence to our population.
Another 30 years from now. Holy moly.
Yeah. So I think that there's this, I was in a program, I think. I was lucky, though. I'll tell you why I was able to make that change at 17. Because when my parents were married, my parents were very health conscious. My dad was very health conscious. He barely let us watch TV. We were outside all the time. He cooked most of our meals. Very healthy. My parents always grew a garden. That was normal in my young life. We had animals around. We had responsibility. My mom was a hard worker. She owned a business, and so she really taught me my work ethic. My mother had a very good work ethic. And so I learned a lot of very healthy things in that programming time.
Yeah.
But then divorce happened, and my stepdad came in, and he did not have as good of health programming. It's very addiction and all kinds of stuff. And so that kind of fell into our lives at that time. And then I, being the age I was, it was easy for me to kind of fall into that. And there was a lot of stress. But I feel like at the age of 17, making the choice that I did for my health was because my foundational program.
Yes.
I knew that this was not right.
Yeah.
I knew there was something better. And unfortunately, a lot of people don't have that. And so I'm not taking that responsibility away from people, but I'm saying it's much harder. And that's why the doctor needs to be the teacher. Because if somebody hasn't lived in that program of like, you can grow a garden, you can eat healthy food, you don't have to be overweight, you don't need to be smoking and whatever. It could be up to the doctor. It could be up to the teacher in school. It could be up to the counselor to teach this person that no, you have the ability to make different choices.
Yes.
And that's where we can really help as doctors.
You need somebody who is like a compass to you, who can show you a certain direction. Even as adults, we can be inspired by somebody either our own age or a little bit older who has walked a certain path or has done a certain training that we're inspired by. And I think that if you don't have that inspiration from people in your life when you're young, then it is very easy to start looking at it in peers, and you start looking, what is my friend doing, and what are they going through, and then you pick up on that energy, and then before you know it, you kind of lose your guidelines. So it is always important that there is somebody or several people in your life who are inspirational, and you always hope that to be your parents, or in this case, a doctor or a teacher or a coach. Something to that effect.
Yeah, and I mean, as a parent, it's overwhelming. There's so much as a parent. You just had kids. Nobody told you what to do. Hopefully you had
not many manuals out there.
You had a good role model, but a
Yeah.
lot of people didn't, and so they're just winging it.
Yeah.
And parenting can be very stressful, even for those of us who are educated.
Yeah.
Because what you learn from your children is that they are their own person.
Yes,
right?
it is.
They are going to make their own decisions, and your job is to try to model the best behavior. And sometimes you have behavior that's not great. If you're a very stressed out person, typically you're going to have a kid who's a stressed out person. Well, why is that? Because that's what they've seen their whole life. You're very stressy, you're type A, whatever. So they're going to see that as normal. But as that starts to bother them, maybe they're getting ill from it.
Yeah.
You as a parent, you got to be awake enough to be like, I need to work on myself and stop this behavior that I have, because my child is just modeling what I have. And I really feel for so many families with the stress that we have today. And I think that healthcare in general means to do well, but that it's not teaching what it should be and making it so that families don't have to go to the doctor. They don't end up in the emergency, they don't end up in the surgery room if they don't have to. And they don't end up with these diseases of excess that are killing us. So if medical mistakes are number 3, we've got cardiovascular disease, metabolic disease, and cancer. And most of these are lifestyle oriented. Again, back to teaching.
Right.
Back to teaching. And the thing I have with not just the medical system, but the school system is we are not teaching our children valuable things in the school system about health. And about stress reduction. I mean, we're just not. And my kids, I've done both homeschool and public school.
Yeah.
And they're both difficult. They both have their pros. They both have their cons.
Yes.
But in general, not teaching children about their bodies, not teaching children about basic health things, not teaching children about healthy food and where a carrot comes from. In Seattle, I worked in low-income neighborhoods. I went in as a nutritionist. Before my medical degree, I was a nutritionist. And I would go in and I would do after-school programs, teaching children how to make healthy food, or teaching their parents how to make healthy food for them. And you can do that on a budget. You can do it with frozen vegetables.
It is actually less expensive than when you buy everything in the store.
Yeah.
It just takes a little bit of time.
You can do it. But I was shocked. Some of these kids didn't even realize a carrot came from the ground. They did not know. There are literally people that don't know an egg comes from a chicken. Children.
Wow.
And it's not their fault. If you live in an urban environment, you don't see chickens. You see eggs in the store.
Yeah.
You see a carrot in the store. You don't know, it's so that was always shocking to me, because I got to grow up in Montana. My parents had a garden. I understood that. So there are a lot of people, by no fault of their own, they're not, they weren't given that education. But in today's world, with the information that we have, with this thing called the internet and our phones in our hand, which are computers, the Library of Alexandria of knowledge literally right in your hand. I mean, some of it's real, some of it's not.
So I want to ask you, though, Dr. Willow Moore, did she kind of put you on the path to where you are right now?
She was amazing because she was hardcore. She was kind of like, if you don't do this, you're going to be sick.
Wow.
And I think that's what I really needed. I think my personality needed somebody that was just going to be like, all right, you want to be sick or do you want to be healthy? And everyone has a different style, listening to your patient, understanding and being a thoughtful person and not being too forceful. That drives some people away, right? But I think when you deal with a lot of sick people, especially chronically ill people, they need a lot of coaching and they need a lot of like discipline, right? And so that's what she gave to me. And it wasn't easy. I will say I learned so much, and there were some things I wouldn't do with a patient. But at the same time, it got me thinking about, as I got healthier, I was like, wow, could I help other people? And so that's really what pushed me into moving to Seattle. I went to massage school for a year. I got that degree, and then I went back to school. I got an undergrad in nutrition, and then I went into the naturopathic medical program. I was a late bloomer. I kind of decided late in life, but that was because I had met and been treated with this cranial treatment for my headaches. So kind of going back to the original topic, I had met this guy named Dr. Howell, and he was north of Seattle in Everett. He was a kind of eccentric naturopathic doctor, first graduating class of Bastyr University, which is probably the most prestigious naturopathic university in North America. And it was in Seattle. And he did this treatment that was traditionally an osteopathic treatment a long time ago. It changed into more chiropractic treatment. The chiropractors kind of took it on, and then the naturopaths. And he learned from a chiropractor out of Oregon. His name was Dr. Stober. He learned this therapy called
Stober?
endonasal specific. Stober.
Yes. Yeah.
And Stober was treating.
It was called bilateral nasal specific.
Bilateral nasal specific.
Yeah, BSN.
Endonasal specifics is kind of the group. It's an umbrella term. And he was treating children that had cerebral palsy and Down syndrome.
Wow.
And he was using this technique where he would put a little inflationary device in the nose, thus endonasal, and he would inflate it. And when you inflate it, there's a bone in the back of the head called the sphenoid bone. And the sphenoid bone, it would move the bone, just like if you go to the chiropractor, it manipulates your spine.
Yes.
It would manipulate that bone. And with cerebral palsy children, they have a connective tissue disorder. So there's different types of cerebral palsy. There's different severities of cerebral palsy. But basically you have connective tissue dysfunction in either one area of your body or throughout your whole body, causes contractions, right? So let's say if I had cerebral palsy in my arm, you might see me have an arm like this.
Right.
And I can't really move it. It's contracted. The connective tissue's tight.
Yeah.
And so when you manipulate the sphenoid, you have inside the skull, you have very thick connective tissue called the meninges. And the meninges, or the dura mater, which is the Latin term for it, which means tough mother, protects the brain and the spinal column. And so there's 3 different layers there, and in between 2 of the layers is where your cerebral spinal fluid flows in there. It's a very small space in the skull, and also going down and up the spinal column. It's bathed in the cerebral spinal fluid. It's very important. And the sphenoid and the meninges together, as well as the sacrum, interestingly enough, they work at pumping this fluid around your brain and up and down. So it's creating this pump.
Okay.
But these children that had cerebral palsy and all this connective tissue dysfunction, because the meninges are actually where your connective tissue starts in the skull and then it branches out as connective tissue throughout your entire body, you see these contractions. And so when Dr. Stober would adjust the child's head and loosen the meninges, it would loosen their contractions.
The fluid would be...
Well, the fluid would be moving, but the connective tissue inside the skull would start translating through the whole body, and then contractions would be able to loosen and relax.
Wow.
And if a child...
What a tremendous innovation.
Yeah.
And
it
help.
doesn't cure, there's no cure for cerebral palsy, but what it would do, it would decrease contractions, which are very uncomfortable, debilitating, can be, in a lot of ways, like if you have a child with it in their legs and stuff, they can't walk.
Yeah.
And they still do these surgeries, I think. I'm not exactly sure, don't quote me on it, but back then they were doing surgeries where if a child was in a wheelchair and they had cerebral palsy, they would just cut the hamstrings.
Wow.
Because the hamstrings, again, are pulling on the head. Because of those contractions,
Yeah.
that meningeal tissue is being pulled on.
Huh.
And so if you cut the hamstrings, the child can sit in a wheelchair without having pulling on his head.
Wow.
But then again, you cut the hamstrings, that child's never going to walk.
Never going to walk, right.
Okay, so what Stober was finding is when he did this cranial manipulation, their legs would relax. And they could sit in their chairs without having to have these surgeries and stuff.
Yeah.
And so that was pretty phenomenal. And he was seeing kids, they were coming from all over the country, I know, and perhaps the world to see him. He was well known for that. And then also Down syndrome. So Down syndrome characteristics, you know.
Now, was
you
this
have
in the 70s or 60s, or when was
60s
Stober?
and 70s.
I'll be darned. Wow.
80s.
Yeah.
He died, I believe, in the 80s. And he was kind of a crazy guy. A lot of these old-time doctors that did all this stuff, they were out-of-the-box thinkers.
Yeah.
They were not concerned with, they were not concerned with the status quo.
Right.
And they were trying to do things that were really revolutionary.
Yeah.
And so he was doing that. And my mentor worked with him for years.
Yeah.
And then I met my mentor because I had these headaches, and I went to him as a patient. And I had this treatment done. I was kind of done everything by then. I'd kind of tried everything. You know, I'd gotten my diet under control. I'd gotten the candida issue under control.
Yeah.
I was feeling much better, but I still had the headaches. Nothing really took the headache totally away. So then when I had the NCR, it was quite life-changing for me. And so at that point, that was when I realized I wanted to be a doctor. Because I legally had to have a medical license to do the procedure.
Right.
And so I was lucky enough to be living in Seattle at the time, and Bastyr was there. And I did all my, I had to do all the education to make up to that, to get to that point.
Yeah.
I got accepted, and then I did the program there. And when I got out of the program, I just literally started working. I mean,
Did you first work with Dr. Howell,
yeah, I
or
worked
did you
for
go?
him for 10 years.
You worked for for him.
Yeah.
Before you went independent.
Yeah, I was his assistant.
I'll be
I
darned.
saw him as a patient, and I was at the time doing injury treatment. I was a massage therapist, and I was doing like injury massage.
Yeah.
And I was seeing people every week with the same injuries.
Huh.
And I was like, okay, you all need NCR. I was like, everybody needs to go get NCR. And then I realized I was not going to be very happy just doing that. And so I pretty much begged him for a job. And he gave me a job, and because he got very busy at back then, that's when you actually got a newsletter in the mail.
I see.
And there were a couple guys that had gotten treated by him that had these huge newsletter followings, and he needed help. He was getting very busy. So I worked with him for 10 years. I helped treat patients. I did all the prep work on patients. I helped him train physicians and their assistants with the physicians. I helped run his front office. I pretty much did everything I could.
Yeah.
And then once I got into med school, I just couldn't work. I didn't have the time. So I stopped working for him. And he still practices.
Yeah. Fantastic.
But I was very fortunate that I found that treatment. And then it kind of it really took the trajectory of my life and kind of solidified what I wanted to do.
Right, and I know that you have helped so many people over the years. I don't know if you have helped thousands, but I'm sure that you're very close. And the results, the people who I have seen, have spoken, who have been treated by you, their life has just changed. Their balance, their strength, their emotions, the effect it can have, this specific treatment, can be, how do I say, everybody is an individual. And when somebody needs the treatment, that's one thing. But how the end result is, it's usually positive, but it can work on different levels. People may not know that it could change their relationship with the people they're with, right? That's one thing. Back pain can be gone. Insomnia can be improved. Hearing can be improved. Breathing. These are just a few. Headaches, obviously, migraines, hormonal issues. There is a lot of issues that actually can improve in people's lives simply by having this treatment done. Now, you just don't treat everybody. You kind of do an intake, and then you see the people, but you're able to look at their face, the facial structure, and you can pretty much tell if they need a treatment of NCR or not. Is that right?
Yeah, so you don't really have to be sick to have the treatment. I think it's beneficial for everybody. I mean, we fight gravity is our biggest problem on this planet. You know, we have a very strong force that's working on our body all the time. And you can see that as you age.
Mm-hmm.
You just kind of start shrinking, right?
Yeah.
And so when we reposition the head on the body, we open that up, we improve that cerebral spinal fluid flow, we can kind of create an anti-gravity treatment. We can give you space, we can help you breathe, we can help you move, you feel more comfortable in your body, you have a better center of gravity.
Yeah.
So obviously, like the cerebral palsy child, that's very severe, right? But you can take somebody who doesn't have that and just help with aches and pains and help how they breathe. I mean, nasal breathing, again, if we're talking about poor health, it's a rampant issue in our culture. We have very poor nasal breathing. And, you know, obviously there's lots of good literature out there related to why this is, but probably one of the biggest is our consumption of poor food.
Carbohydrates, rich, too much.
Too much and like simple carbs, sugars, flours, things that have been shown over generations to narrow the skull, narrow the bite. I mean, how many of us haven't had braces?
Yeah, it's true.
And back in the day, I mean, a lot of people that lived tribally and ate their cultural and tribal diets, all their teeth grew in straight and not crooked. So their bites were larger, wider. And I'm sure a lot of your audience is familiar with Weston Price and his work. But he is really the one that showed through his research and through the pictures and through his generational research in tribal communities. Here in the United States, I believe he traveled to every Native American tribe in the United States. Wow. He traveled throughout Africa, and he took pictures of people that were still sort of living like they had before, and he took pictures of them living either reservation life or living now where they were being fed white sugar and flour, and their skulls are thinner, narrower, their bites are not well, and they have breathing disorder because the upper airway is right behind your nose going into your throat. That's right at the back of the palate. Yeah. And so if the head is narrowing, then the palate is narrowing and the bite is narrowing. The teeth can't all get space, so they grow in crooked. Right. And we have that high, narrow palate, which in the back is going to constrict the airway. Huh. So now you can't breathe through your nose.
Right.
And breathing through your nose is vitally important for brain health, hormonal health, sleep, relaxation. And I would say we have an epidemic of sleep apnea. Yeah. Again,
it's true. It's unbelievable.
From poor structure, cranial structure that you may not even had any choice over, right? Because your mother and your grandmother have been eating poor diets since post-World War II era. Lots of sugar, lots of white flour. And we know that Northern Europeans and Europeans in general have also been eating like that for a very long time. True. And this is why, Latin cultures and Native American cultures and, African tribal, when they're introduced to these foods, we know what happens, right? True. And so as like European ancestry, we've had this going on a long time. So, probably poor nasal breathing and etc. And I have there's a great book called Land of the Spotted Eagle by Luther Standing Bear, and he was one of the first Native Americans, he was in the Buffalo Bill, Wild Buffalo Bill show, in the early 1900s. And he remembers living in the plains as a Sioux Native. And he wrote a book called Land of the Spotted Eagle. And in there, he talks about every life stage: children, marriage, adulthood, war, their spiritual practices. It's a great book. And if you want to learn about health, it's a great book. In there, he talks about how the white men all have this problem like anemia. They're all anemic, and they're all depressed, and they all have mental health issues. Things they never saw in Native American culture. Never saw anemia, never saw mental health disorders, didn't know what anxiety or depression were, and these were very common within the white culture.
Yeah.
Now, if you take that to diet, you probably translate that into, he also said they had very poor diets. They were eating lots of processed food. And again, he saw this happening to his native peers and himself as they started eating, were put on reservations and were eating poor food. So you start to see, well, one, addiction, but then you start to see poor structural issues and fetal alcohol syndrome. And that goes
to the next generation.
Goes to the next generation.
Because that's what we teach. As we said earlier, you pick up on people who inspire you or who are your guides. Now, as far as the NCR is concerned, we're coming close here to the end. But
we can talk about this for
hours. I know, you and I can easily talk a long time. Would you mind explaining a little bit, what is the sphenoid bone, Sphenoid, where is it located, and what is so special about it? We have our friend, half friend only, sitting over there. That's right.
Yeah, so this was a female. This is a life skull. This is real.
It is really?
Yeah, this is not, I don't even know if this is legal. Like, I've had this for a long time, and it was given to me by one of my other mentors in cranial therapy. Now they're plastic and they're not, but even not that long ago, but they, like in India and stuff, they'd sell skulls for money. And so a lot of medical places had these real skulls.
Wow.
Which is great, actually, because this gal, you see the asymmetries, which in a plastic skull that's been made to depict what's good and perfect.
Yeah.
I don't really see that in anybody, right?
Yeah.
So she, obviously, if you look at her septum was deviated
to
the right.
I see that. That's right.
Yeah, so she couldn't really breathe through that right side of her nose probably as well as her left, right?
Yes.
So we've heard about that septum deviation, very common, again, with breathing disorder. If you look back here, you can actually see the upper airway.
Correct.
Okay, and when you look through there, you can see that her septum is also offset.
Also, yes.
And then the sphenoid bone comes down along the upper airway. So this is where we're moving. And then the jaw, the occipital bone, this is where your vertebrae sit.
Yeah.
So, your vertebrae are holding up your head on these two little condyles, which is crazy. So the sphenoid bone is actually this big bone right in the middle. It comes all the way across both sides. Looks like a butterfly.
It does look like a butterfly. That's
and right on the center of it is what's called the sella turcica. This is where your pituitary gland sits.
Okay.
And this is what controls most all hormones in your body.
Yes, they do.
Okay. So it sits right on that bone. And then it comes down and it has wings that come down by the airway.
Yeah.
Now, if I were to take, this would be one that was pulled out. This is just a plastic replica. But this goes to show you what it looks like.
That's the sphenoid.
This is the sphenoid.
Okay.
And so this, if I were to touch here, these are your temples. Right. So you can touch your sphenoid by touching your temples. Yeah. And so the problem with the sphenoid is that it's encapsulated in the skull, so it's hard to get to.
Yeah.
There are different ways. We do endonasal. It's the easiest. You can go up into the mouth behind the pterygoid process, and you can come up and touch it here.
Okay.
That's very hard, as you can imagine. People have teeth.
Yeah.
They also have gag reflexes. So it's harder to do that. So the endonasal people think like, ooh, why would you want to do that? It's actually easier because we can, I've got my little instrument here. You can slide this little lubricated inflation device into the nostril, and it'll go back to the back airway. And when you just inflate it a little bit, it just pushes on the bone.
That's it.
Yeah, and so you're not going by teeth. It's not doing any of that.
I think one thing that I learned from you is that the skull itself has 22 different bones.
Yep.
And 19 of those are connected with the sphenoid. So adjusting the sphenoid will affect 19 bones except the nose bone and jawbone.
So these two little nasal bones right here and the mandible, which is this bone,
the jawbone,
are not directly attached. But you can see in
everything else is attached.
Everything attached, because all the correlations, they all attach somewhere in there.
Yeah.
Yeah. And the mandible actually moves, because when the upper jaw moves from it, the mandible and the temporal bone moves. This is your TMJ joint. It's going to naturally move. It's just not correlated. It's not touching the sphenoid. But you will get jaw changes, TMJ changes. And so the sphenoid is like very impactful. And what's interesting is Dr. Sutherland, who was a very famous osteopath, he was one of the fathers of osteopathic medicine, who were the original cranial doctors. They're now DOs, is their title, DO, and a lot of them are still doing great osteopathic cranial care.
Yeah.
Some aren't. They were taken over by the AMA in the early days of really trying to run everybody else out of town. The DOs had to conform, basically, if they wanted to stay alive. The United States was full of naturopathic colleges, homeopathic colleges, and chiropractic colleges prior to the AMA coming in and setting a standard of care and attaching the programs, the medical programs, to a 4-year institution where they could get really good funding. These private schools were not able to keep up with the just everything that was required for standard of care that the AMA set up. So osteopaths decided to go with MDs. So you'll see a lot of DOs. They're basically MDs, but if they're a DO, they might have been taught cranial work. And so they're the original cranial doctors. And Dr. Sutherland defined this thing called the primary respiratory mechanism. And this is the whole idea of when we adjust the sphenoid, the connective tissue within the skull moves, and then stimulate the meninges, which are lining in here, and your brain is in here too, it's lining. When the sphenoid moves, it stimulates the meninges to start flexing.
Right.
So, like when a baby's born, they look really funky. And then over a couple days, their head is rounder.
Yeah.
That is from the meninges doing this.
Right.
Moving. And midwives used to do cranial manipulation on newborn babies.
Right away.
And stimulate their meninges to move so they wouldn't have weird head shapes. We don't do as that. It was called cranial molding. We don't do that as much anymore, but midwives might still do that. And that was important. But Dr. Sutherland defined this primary respiratory mechanism.
I see.
And the primary respiratory mechanism is every single time you take a breath with your respiratory system, your head moves because your meninges move.
I see.
And then that pumps your cerebrospinal fluid around your brain and your spinal column.
Right.
And that was defined as the primary respiratory mechanism.
So that is something that they learned because of this manipulation.
So they learned that they could manipulate the meninges and the bones in the head to stimulate immune function, to change these connective tissue disorders in the body, to improve breathing, to improve brain function. And osteopaths were doing that a long time ago to decrease pain, right? To change where the head sits, so less neck pain, less back pain.
And so when somebody comes to you and needs to have a treatment, so you have observed this person and said this would be beneficial to you. And based on the symptoms they have and the fact that they probably have had a concussion, had whiplash, maybe born with forceps, have had certain falls, whatever it is, whatever stressors in the body that have affected this and the sphenoid, then you give them a treatment that is about a 4-day treatment. So it is Monday, Tuesday, Wednesday, Thursday, and every day you reevaluate what part of the sphenoid or what side of the sphenoid needs to be adjusted based on how the body looks that day.
Yeah, so I learned this testing called proprioceptive testing. It's a chiropractic testing that looks at stability. Also,
Proprioceptive?
proprioception. So
Proprioception.
proprioception is basically how your body is in sees space, like how you stand, what your balance organs are doing, like where are you in space. Your nervous system is always paying attention to that, right?
Yeah.
If you've ever had vertigo, if you've ever had anything where like you completely lose proprioception, it's very disorienting.
Yeah.
Right? You can't walk, you got lots of problems, and so our proprioceptive system is constantly picking up on cues to keep us stable.
Right.
And so the testing is really directed at looking for stability patterns. And then the sphenoid can kind of give me an idea of what's stable and what's not. And then we treat that. That technique with the NCR is different than the endonasal or the bilateral nasal. And the bilateral nasal, they didn't test for that. They just did all the passageways. And so everybody got like the same treatment. We do it a little bit differently where we do the testing, we do body work, we're incorporating a lot in. So it is a form of endonasal specific. The technique itself is different.
I see.
And there's been other people that have learned the NCR or the endonasal and they've taken it out and they've added their own things to it and they call it something else. So NCR is one form, FCR is another one, functional cranial release, that's by a chiropractor associate in Florida, Dr. Laurence. Cranial facial release technique. So you'll hear people will call me like, what do I do? I've heard all this. I've heard all these names and blah, blah. They're all based on the same idea. And usually what it is, we're still using the same instrument.
Okay.
And we're applying the same pressure. There just may be other things thrown in that make it a little different, like maybe chiropractic adjustment or a body work or whatever. So that's more marketing. Does that make sense?
Absolutely.
So I was trained in NCR. I never changed the name. I haven't taught it. I don't teach it. So like I just use what I was trained in.
Yeah.
But other people decided they wanted more out of it and they took it and they added other stuff. So that's where you'll see some of the confusion. But we're all really working on that sphenoid, the meningeal tension to do that and to improve structure, improve breathing.
Yeah.
And if there was something you wanted to do, there's obviously some contraindications to it. Any recent fractures or breaks in the face, you got to be healed. If you're on blood thinners, we're very cautious just because you might have a little bleeding. We want you to be able to clot.
Yeah.
Bleeding is actually pretty rare these days.
Yeah.
And I also go situation by situation. And so I'll make a clinical decision whether or not. Some people have imaging and they come in and, we can look at the imaging and be like, okay, you can see your septum deviation, whatnot.
Yeah, yeah.
Sometimes we're trying to spare people from having to get the nasal surgery. We're trying to see if this would help instead of having to get the nasal surgery.
Yeah.
As most people who have had nasal surgeries know or were told by their surgeon, they're really only about 50% effective and may last. So I always tell people, like, if this sounds interesting to you, it may be worth trying first.
Yeah.
Because it might spare you a trip to the surgeon.
Yeah.
And nasal surgeries are one of the top surgeries done in the world.
Yeah.
Breathing disorder surgeries.
Unreal.
And
I had no
they
idea.
are really hard surgeries and they are very difficult recoveries.
Yes.
There's no drugs involved with this treatment. There's no surgery. You walk in, you walk out. And hopefully over time you will feel better. There will be changes. Your body will be adjusting to the skeletal changes, and so the muscles take longer. So there are things that can happen during the treatment, and that's why we see you and monitor where you could be sore, you could be tired, you could have lots of nasal drainage, especially if you got lots of sinus issues.
You could be happier.
You could be happier.
That's what I heard.
And that's another thing is that the brain is structurally it needs food. And so if the cerebral spinal fluid is compromised or you were in an accident and your brain has been compromised and this whole system has been compromised, you need to get that working better because that in itself will help certain areas of the brain get the saturation that they need, such as serotonin, dopamine, whatever, to improve how you feel as well emotionally. And I've had plenty of people say, like, wow, I've had counseling for 20 years, and after 4 days of treatment, I feel like I don't need that.
Yeah.
And so again, based on situations, we always need to assess the structure. We can't just assess the biochemistry. We have to assess the biochemistry while addressing the structure, because the structure can influence the biochemistry.
Yeah.
And that's why we're like in a physical body.
Yeah.
We can't just always think that it's just something like a drug or supplement or whatever. Like it might actually be the structure.
Well, with the way you indeed have been explaining this, we have looked very little at the skull, but super interesting. But your passion is indeed helping people, and based on your explanation about what the way you've been raised in your youth and what you eat when you're young, and diseases, disorders, possible accidents that you may have been involved in that weren't treated correctly, weren't healed up correctly, all these can have an effect on the way your skull works, your sphenoid is out of balance, and how it can affect the body. So I think it is a fascinating topic. I do hope that listeners and viewers are going to look at it more in their own time, do some research on some of the NCR treatment, neurocranial restructuring. But what an incredible invention, and it's wonderful that you have had already so much success, and I do hope that you have more success as your career keeps going.
I appreciate it, Jacobus. You've been very kind to me and sent me a lot of patience, and I want to thank you too for the very selfless service you give to a lot of people by helping them find resources, because I think that's where a lot of patients will feel really lost, is they are tired of the medical model. They don't know where to go.
No.
They don't know what to do. And so giving them resources, again, you are being, even though you're not a licensed doctor, you are doing docer. You are teaching. And that's so important. That's what people need. And that's why when you recommend this crazy treatment to them, they come because they trust you.
Yeah.
Right? It's all about trust.
That is.
It's all about trust, you know?
Well, that's wonderful. I'm glad to do it. And I want to thank you for being, I'm so glad you came back to this area.
Yeah.
So it's easy for me to refer people to you. But thank you very much for coming in and doing this interview with us. And I hope to see you again soon.
Okay. Thanks.
All right. Folks, thank you so much for listening and viewing, obviously. I hope you learned something. You can reach Hillary at her own website. We'll place it in the video later as you are finishing this up. So thanks for listening, and we hope to talk to you again soon. Thank you.